pathological basis for the given condition, and the given condition is vitiligo. So among the given options, if you have chosen option B, loss of melanocytes, your answer is absolutely right. So just remember option A, lack of melanin. This is observed in a condition which is called as albinism. And option C, loss of melanosomes. It is seen in nevus D pigmentosus, which is also called as nevus A chromicus. So let us see. So albinism, it is basically a disorder which you might have read in your biochemistry, which is autosomal recessively inherited condition due to the absence of the enzyme tyrosinase. And I hope you all know the tyrosinase enzyme is most important for the synthesis of the pigment, which is melanin. And since this is defective in these patients, melanin production is hampered. Whereas in the nevus animicus and nevus depigmentosus, the melanosomes are going to be defective in that they are not going to transfer to the keratinocytes properly, and because of which there is going to be hypo or depigmentation which can be seen over the skin. Sarve jana sukhino bhavantu.